The two neoliberal problems that Bangladesh had that were worse than much of Asia, not all of it, but much of Asia, were in healthcare and education. The privatization of education and healthcare, let me put it in other ways, the diminishing of pouring funds into education and into healthcare impacted everybody. Let's look at healthcare first. Um, Bangladesh had a government subsidy for healthcare costs that is much lower than much of South Asia, certainly India and Pakistan. This made healthcare very costly. On top of, in the last 3, 4 years, since COVID, 4 years, on top of inflation edging higher, that became a problem when you have healthcare costs at that range. In fact, they rank, according to the World Health Organization, they don't rank very highly in providing healthcare. Um, and according to the United Nations, the healthcare system is not affordable. It's hardly the model like the many European countries, especially the Northwest European countries, have universal healthcare, or Canada for that matter, by the way. And it is for a country that does not have high living standards, does not have a strong middle class, a sizable middle class, this is a problem. So healthcare, which appears nowhere, it's the quotas. We have these quotas. They were giving, which the quotas became. I understand why the students, the young people and students made this an issue, because it is a problem of highly symbolic of corruption and patronage. Okay. However, healthcare is universally applicable. It impacts everyone in Bangladesh. Okay. But it wasn't a forefront issue. Another issue is education. There are estimates that because of neoliberal, because the state dropped the money given to public schools, many children were left out of public schools, especially in rural Bangladesh. This is a problem. Uh, Another problem with regard to this issue, they adopted the Western neoliberal model of higher education, pay as you go. In other words, um, the um, the private tuition-based model. This also is a problem. So what you have is, when you don't have social development, like China does, for example, China, which, and I mentioned China because it's in Asia, when you don't have that kind of level of social development, commitment to education, which President Xi, for example, has made even more of a commitment, and to health, schools, hospitals, clinics throughout the country, there is an issue.